Juvenile idiopathic arthritis, also known as JIA. Disease population etiology. Juvenile idiopathic arthritis is the most common arthritis in children aged 16 and younger. There are 7 types of JIA, classified by signs, symptoms, amount of joints affected, family history, and lab tests. It is an autoimmune disorder in which the body's immune system attacks organs and tissues that affects one's joints. The etiology of this disease is unknown, but researchers believe it's a result of genetic and environmental factors. Approximately 300,000 children in the United States are estimated to have some type of JIA. JIA range from 4 to 14 cases per 100,000 children annually in the United States. Clinical presentation. JIA presents with joint inflammation in one or more joints. Signs and symptoms may include inflammation of the hands, knees, elbows, wrists, and ankles. Symptoms must be present for 6 weeks to be diagnosed. JIA may also present with daily fevers that can last up to 2 weeks, skin rashes, swollen lymph nodes, liver, and spleen. This arthritis may cause joint pain and stiffness after long periods of sitting. Symptoms may only last for periods of time, while for other children, symptoms can last a lifetime. Progression and prognosis. Most children outgrow JIA, but it can affect a child's bone development. 41% of patients with JIA claim it is active with mild to severe symptoms treated with medication. If a child does not outgrow JIA, the disease can progress, affecting more joints. A child may first experience warm, tender, and swollen joints in the hands, feet, and knees. Joint stiffness may continue to cause pain, and a child may experience decrease in range of motion, develop contractures of joints, fatigue, weight loss, or cause limbs to become limp. JIA can be slow or abrupt, affecting a child at temporary times or for their entire lives. They may go through periods of remission. Challenges with play. Depending on the type and severity of JIA, can create different challenges for each child. Play is an important part of a child's life, and JIA can make this difficult. Some challenges include stiffness of joints after sitting for long periods of time, or being unable to move joints, making playtime short or not very comfortable. Swelling or pain, making it difficult to grasp or hold on to objects for very long. A child may have difficulty with posture while sitting, struggle with fatigue, emotion, manipulating, lifting, transporting, and limited range of motion are all factors that may make playing with toys difficult for a child who has pain or stiffness in their joints. Challenges playing a card game. Picking up cards due to swollen fingers or stiff fingers. Holding cards in hand for long periods of time, having issues with grip or manipulation. Not being able to put elbows on the table due to pain in elbows, making it uncomfortable and affecting one's posture. Depression or frustration because a child is unable to participate in activities they enjoy. Fatigue, sitting for long periods of time that cause stiffness and pain. Impact on patient. Trouble participating in school or activities due to pain. Missing school due to appointments. Pain may make it hard to sleep at night. That may make it hard to concentrate during the day. Medication given for pain making one feel drowsy or fatigued. Sudden or prolonged times of pain that are abrupt and disrupt everyday life and performance. Impact on family. Appointments may cause them to miss work often. Financial burdens for medication, therapy, or doctor visits. Decreased family time due to lack of energy of a child. Focus being heavily on one child more than another. Lack of family communication that may cause a strain on family relationships. Modified UNO. Supplies needed. UNO cards, flat magnets, gloves only for the game, and this is because they have magnets glued to those gloves, so these particular compression gloves should only be used when playing the game that has magnets attached to it, and a hot glue gun.